Yeah. Yes. Well, the story about cattle in the U.S. where they have these massive feedlots in places like Kansas, and they will be just like hundreds of square kilometers in size, and these cows are packed shoulder to shoulder, knee deep in feces and urine, and they're fed soy and other growth factors and massive amounts of antibiotics to ensure the growth, to fatten them up for market. This is not how animals should be treated. So there's an ethical issue. But secondly, I think it does produce an inappropriate food source. It makes it very cheap. But I think meat should be expensive because you shouldn't eat very much of it, personally. Yeah, yeah. I mean, anything over 120 grams is wasted because you can't break it down and actually utilize the food. And 120 grams of beef is tiny, and you only need that 2 or 3 times a week if you are, in fact, wanting to eat red meat. Yes. Look. I'm chemotherapy is brutal, but it is probably the best initial approach for many kinds of tumors that have metastasized. It gives us a window in which to deal with surviving. It does put people into remission. And then you have a window where you can actually prevent that. As I said before, there are a lot of herbs that have been studied, supplements that you can use with chemotherapy to ameliorate some of the side effects of that. So while it may be brutal, I believe that we don't really have a viable alternative at this time. So I have patients who come to me and say, I don't want to use chemotherapy. And I'm reluctant to actually encourage that, because I've seen people come in my clinic who've gone through the so-called alternative route, showing up in late stages of cancer, and they're saying, I thought I was going to treat it naturally. I hate the word natural. I mean, it's just meaningless. So while it may be brutal, and I don't know we have an alternative. However, I think it's also important to know what kind of chemotherapy you're using. Because one of the things about that happened, this is a kind of a political, financial issue, that before 1996, chemotherapy agents had to be proven to enhance life expectancy. After that point, all they had to be proven is to shrink a tumor. So it doesn't mean you're going to live any longer. You just get a more expensive drug. So some of the older chemotherapeutic agents are just as effective and certainly much, much cheaper. Some of these drugs are costing $100,000 for somebody to go through a 3-month course. I think that's obscene. So anyway, this is a bit of editorial on that. But you go to somebody who knows. That's why people like myself. Well, that's why. Well, an oncologist, like anybody who's a specialist, for example, if you call a plumber, he's going to find issues with your plumbing. You call in a carpenter, he's going to find reasons to repair your house in terms of its structure. So an oncologist is going to apply his. Carl Rogers, a well-known psychotherapist, said, if the only tool you have is a hammer, you keep on looking for nails. So it's the same thing. That's why you need a group of people, an oncologist, a complementary healthcare practitioner. You work as a team, and then you get the best results. Yeah. Yes? Not intravenously? Yes, I think there's some good research on it, not for all types of tumors, but certainly for some kinds of solid tumors it seems to be effective. Look, I don't know. I haven't seen the research on that. I've seen it on lung cancer, seen it on bowel cancers, but no, I don't know it on melanomas. Anybody know any research on that? Okay. Again, just go to Google Scholar or Medline, type in vitamin C, melanoma, and see what you get. I mean, it's Remember when I was a student back in the 60s? And you go to the library and you get out a book and you sit down and you read the book and you find a reference and you go back to the stacks and you'd get another book. And you'd be there all night and you'd read 2 or 3 things. Now you get into the internet and you got 10 windows open and you're getting all this information. So, yes. I can't make a specific answer. It depends on what kind of cancer, what stage it's at, what the problems are. And again, so there are no generalizations. Just like there's no simple one chemotherapeutic agent for cancer. You have to go to a practitioner. You have to go to somebody. Look, I'm doing a second doctorate. I'm doing 5 years of study. I'm doing research in China. I am considered an expert. You need to go to somebody who knows and who's studied. These are not things you take lightly. So go to somebody who knows. Well, one of the things you do, and this is what I do, when a patient comes and they say, I say, this is what I'm giving you. This is the research. You go to your oncologist and you tell them this is what you're doing, or I won't treat you. And so they go to their oncologist, kind of timidly. They go, I'm doing this stuff. Some of them go, well, if you want to go ahead. But slowly, there's an impact happening because they're seeing that somebody is responsible. And that's our responsibility as complementary healthcare practitioners, is to communicate that we are educated in the area and that we are talking to them. And slowly, and in the United States, this is happening, and it's driven by the consumer. No. And I think we need to recognize that nobody has the final answer. Yeah, we need integration, absolutely. Yes. Yeah. Yeah. I think so. I think you would, I ask when I'm getting that, I ask for blood tests. And I look at all of the standard factors, but I also look at, urinary melatonin. I look at vitamin D levels and so forth like that. I look at the whole range of things so I have an idea. I look at inflammatory markers. I want to know what C-reactive proteins are. I want to look at the cytokines. So then I have actually solid information on how to approach that. And that's why I said to this woman in the States, have you done your blood test on your D3 levels? Because that level of D3 is toxic. Yes? Right. Yeah. Yeah. I that ratio, I doubt, would be a critical factor. I mean, if we look at historical hunter-gatherers, many hunter-gatherers lived on rivers or at the coast, and they were eating high levels of, you're only getting, if you're starting to bleed or you're getting easily bruising, then maybe you're getting too much omega-3. But I wouldn't worry about it as an issue. The quercetin, I haven't seen that study. The beta-carotene, I have seen that study. It is false because it was synthetic that they used with lung cancer who are still smoking. So, and this is the whole basis of using antioxidants with chemotherapy. They said, oh, these people actually got worse because... So, I don't know that